Hi, this is Dr. Artie Kavanaugh, University of California, San Diego, and I'm here for Room Now and talking about the American College of Rheumatology meeting, of course, which kind of started today. They had some lectures today, and I know there's been other Room Now programs that have talked about some of the things that were covered, particularly the year in review. And I think there was also an introductory talk about COVID, a hot topic, of course, for all of us in rheumatology, all of us in medicine this year. But a lot of excitement sort of going into the meeting. The meat of the meeting will be tomorrow. I think there's quite a number of themes that we're seeing. In rheumatoid arthritis, boy, there's been a lot about the safety. Everybody's very excited to see some actual data from the oral surveillance study, the 1133, the long-term study of tofacitinib at different doses initially compared to a TNF inhibitor. Now, we've heard rumblings about this, and there's been all sorts of interest in this. In fact, it was covered by Dr. Karen Kostenbader in her year in review in rheumatology. And as she said, we just really need the data. So it's really very exciting that at this meeting, we do have presentations of the data. There are 5 abstracts related to the oral surveillance study, and they will provide data on the overall study, the MACE, the major adverse cardiac events, that was the co-primary endpoint, the malignancies, excluding the cutaneous malignancies, and also, though, very interesting data on the clotting events, which we had heard something about, and some data on infectious events, which we really had not heard about before. So we're going to look for these. I think that's going to be a real interesting hallmark of disease. And I think the most important thing I'm looking for is the individual risk factors. We know that to get into this study, which included 4,500 patients almost, that you had to have a risk factor for a cardiac event. Well, we know that there was a difference in outcomes across the different exposure groups, the TNF inhibitor compared to the 5 milligram twice a day dose of tofacitinib compared to the 10 milligram daily dose of twice a day dose of tofacitinib. But we don't know about the people who had those events, which were relatively small in number, but as I say, have gotten a lot of attention. But who are the people who had those events? We've seen so many other studies that have looked at this. They've looked through this databases for tofacitinib and for the other JAK inhibitors. We know that the FDA has had what some people would say has been a relatively cautious line, and that is that they've grouped these for all of the JAK inhibitors, including ruxolitinib, which was not in the initial warning as it's used for oncology, but the topical form of ruxolitinib is now approved in atopic dermatitis, and it too shares the warning label with what we've seen for tofacitinib, for baricitinib, for upadacitinib. So it's going to be very important to get into these data, into the weeds of the data, to really tease out who is going to be at the greatest risk. And that's the most important thing that we have to sort out as clinicians. But that's not all at the meeting. There's a lot of other things at the meeting. And I know for Room Now, there are a number of correspondents who are covering this. I think we'll cover the breadth of the different diseases, the different therapies, and a little topic about COVID, about which there are really quite a number of interesting abstracts. So it's going to be an exciting meeting. I think we wish we were in person. We wish we could go up to the posters and ask the presenters about, well, what about this risk factor? What about that particular subgroup of the study that you're talking about? We're not able to do that as efficiently as we could if the meeting was as it would normally have been in person, but we try to do the best we can. So Room Now will really jump in and try to tease out all the relevant information that is available at ACR and present that to you as quickly as we can afterwards. So stay tuned, keep watching Room Now, and thank you for watching, and we'll see you in a little bit.